Hi students, today we are going to discuss about the anti-anginal drugs. These are agents used for the management of angina. Pathophysiology of angina. As a result of obstruction of coronary blood flow, there is insufficient oxygen supply to the myocardium. It will lead to ischemia or chest pain. This is known as angina. Normally, there is a balance between oxygen demand and oxygen supply. The oxygen demand is met by the heart rate and force of contraction, and the oxygen blood supply is maintained by coronary blood circulation. In case of angina, there is imbalance in the oxygen supply and oxygen demand of myocardium. So we have the treatment options such as either we have to reduce the oxygen demand. For this, we have to reduce the cardiac workload. The cardiac workload is determined by heart rate and force of contraction. Or another option is we have to increase the oxygen supply to myocardium. There are three types of angina, which include stable angina or classic angina or effort angina. Unstable angina is also known as crescendo angina. And there is another variant also, that is variant angina or Prinzmetal angina. Stable angina is precipitated by any physical activities, and the unstable angina is angina occurs even during rest, and the variant angina is due to coronary vasospasm. The anti-anginal drugs can be organic nitrates, beta blockers, calcium channel blockers, and potassium channel openers. Organic nitrates can be long-acting agents such as isosorbate dinitrate and isosorbate mononitrate. And the short-acting agents are glyceryl trinitrate and nitroglycerin. The short-acting agents are usually used during acute attacks of angina. Another groups are beta blockers. Beta blockers can be selective agents, non-selective agents, and mixed blockers. The calcium channel blockers can be dihydropyridine derivatives and non-dihydropyridine derivatives. The potassium channel openers including nicorandin and pinozidic. Short-acting agents like glyceryl trinitrate and nitroglycerin are used for acute attack of angina. All other drugs are used for the prophylaxis of angina. The organic nitrates are glyceryl trinitrate or also known as nitroglycerin. Mechanism of action of nitrates. These are prodrugs. That means we will give an inactive form of drug to a patient, and the drug undergo metabolism to form its active ingredient. This is converted to nitric oxide in our vascular smooth muscle. Nitrates, they penetrate the vascular smooth muscles and they undergo conversion into nitric oxide. This nitric oxide will activate the enzyme guanylyl cyclase. As a result of this, there is increased level of cyclic GMP, which will causes dephosphorylation of myosin light chain. And the myosin light chain phosphate is converted to myosin light chain only. As a result of this, there is failure to interaction with the actin filaments, which will causes vasodilation. Pharmacological actions of nitrates. In vascular smooth muscles, they dilate veins more than arteries. Nitrates, they causes peripheral venodilation, thereby reduces the venous return. It will reduce the preload. Nitrates also causes coronary vasodilation, thereby improves the blood supply to myocardium. As a result of venodilation, there is reduction in preload and reduces the cardiac workload, and it will reduce the oxygen demand of myocardium. It will causes relief from angina. Nitrates also produces coronary vasodilation, thereby redistribution of coronary blood flow to ischemic areas occurs, and there is increased oxygen supply to myocardium and also produces relief from angina. Routes of administration of nitrates. For acute attack, we can give the drug through sublingual route. The agents used are glycerate trinitrate and isosorbate dinitrate. Advantages of sublingual routes are there is rapid onset of action and there is high bioavailability. For prophylaxis, we can use transdermal patches of glycerate trinitrate. In case of myocardial infarction and cardiac failure, we can use intravenous glycerate trinitrate. While orally, the isosorbate mononitrate has maximum bioavailability of 100%. Adverse drug reactions of glycerate trinitrates causes thrombing headache, lurching, hypotension. On long-term use, there is development of tolerance. Uses of nitrates. We can use it for the management of angina because it reduces the cardiac workload and improves the myocardial blood supply. Can be also used for the management of myocardial infarction because it reduces the oxygen demand and increases the blood supply to myocardium. Can be also used for the management of cardiac failure and hypertensive emergencies. Can be also used for the management of cyanide poisoning. Uses, we can use it for classical angina because the nitrates causes venodilation, thereby decreases cardiac output and reduces the cardiac workload, and it also causes coronary vasodilation, thereby improves the blood supply to affected area of myocardium. For acute attack of angina pectoris, we use sublingual glycerol trinitrate. It's the first line agent for acute attack of angina. We give 0.5 milligrams sublingually. The pain is not relieved in 5 minutes. We can repeat the dosage up to 3 tablets in 15 minutes. Then we advise the patient to spit off the tab as pain subsides to avoid side effects like headache. Alternative agents for acute attack is isosorbate dinitrate. For chronic prophylaxis, we can use long-acting nitrates like isosorbate mononitrate. Nitrates can be also used for vasospastic angina. Glycerol trinitrate will reduce pain by improving the coronary circulation. In case of unstable angina, we use intravenous glycerol trinitrate due to reduction in cardiac workload and coronary vasodilation. In case of myocardial infarction, we use intravenous glycerol trinitrate to reduce the cardiac workload. In case of cardiac failure, nitrates reduces the preload and improves the cardiac function. It can be also used for the management of hypertensive emergencies. In case of cyanide poisoning, the hemoglobin is converted to methemoglobin, and in presence of cyanide, it is converted to cyanomethemoglobin. In presence of sodium thiosulfate, the methemoglobin and sodium thiocyanate is produced, and it can be easily excreted in urine. Beta blockers can be also used for the angina because they reduce the cardiac workload by decreasing the heart rate and force of contraction. The calcium channel blockers can be also used for the management of angina because it reduces the force of contraction, thereby reduces the cardiac workload. Calcium channel blockers causes arteriolar dilation, so there is reduction in afterload and reduces the cardiac workload, and there is decrease in the oxygen demand of myocardium. As a result of this, there is relief from angina. Calcium channel blockers also causes coronary vasodilation, thereby improves the oxygen supply to myocardium and relieves angina. The result of blockade of calcium channel, it also reduces the heart rate and force of contraction, thereby reduces the cardiac workload and decreases the oxygen demand and produce relief from angina. Potassium channel openers, the agents are nicorandil and phenoxyl. That opens the ATP sensitive potassium channels and produces hyperpolarization of the smooth muscles and causes vasodilation. It causes arteriolar dilation and venodilation. It also improves the coronary blood flow. The side effects of nicorandil include nausea, vomiting, formation of Fox's ulcer, and headache. Other drugs which can be used for the management of angina is low-dose aspirin because it has antiplatelet activity. It reduces the incidence of myocardium and death in patients with angina. It's all about this topic. Thank you. In this chapter, we studied about the drugs used for the management of angina. can be nitrates, beta blockers, calcium channel blockers, and potassium channel openers. Among nitrates, the short-acting agents are used for acute attack of angina, and the long-acting agents are used for prophylaxis. For acute attack, we prefer sublingual administration of leverairfine nitrate because it has rapid onset of action. You can also use the drugs such as beta blockers, calcium channel blockers, and potassium channel openers for the management of angina. And we also use low dose aspirin for the management of angina because they reduce the incidence of myocardium and death in patients with chronic angina because the low dose aspirin has antiplatelet activity. All about the topic. Thank you once again.